Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. No kidding.
Good morning.
Oh, the
beautiful sunrise.
Oh, it is. It's beautiful sunrise. And you have been rising with the stars, doing lots of things. Oh my gosh, he has no idea.
Happy Mother's Day in advance.
It's coming
Let me
up.
be the first
Mother's
one.
Day.
It's tomorrow.
Yes, thank you. Well, you make a lot of yes.
Anna became a tropical storm.
Oh,
So,
I didn't realize that.
yeah,
but not
overnight.
here.
Well, no,
It's
she's
up
going to
in
be in
Myrtle
North
Beach or
Carolina.
somewhere, yeah.
North Carolina is going to be
So
in that area.
okay, so we don't
Tropical storm
have
Anna.
right. But
Anna is chasing my friend Wendy because Wendy going to Georgia, trying to keep her put here.
so Dr. Mencia, have you had an exciting week?
Very exciting, very, very exciting, very interesting. It's one of those wow week that put like all your effort and everything that you do together to say, like, well done. It's like one of those gifts from God that put a light in front of you saying you're on the right path. Keep doing what you're doing. So we have one of my patients, with many patients, they know that if there is something that is not a true emergency, that you don't need to go to an emergency room, and you feel it's something that I need to take a look at, a lot of my patients, they know I keep an open door policies. You just come right in and we squeeze you between patients if it's urgent. If not, we'll make you wait until the proper time to get you in. So one of my patients, this lady in her late 50s, she woke up and she was having flutter in one corner of her eyes. So that's when you have those little spots that fly by. When, like if you stare at a bright light and you look on the other side and you get those flutter going back. Usually we see it on both eyes and they go away. She was having it on one side, one quadrant of her vision, and they would not go away. And she said, let me go to see Dr. Mencia because this is not normal. Her mom became blind of one eye then the other at a young age, in her early 60s. And so she said, let me go and see Dr. Mencia, see what's going on. So she's getting ready to come to the office. This is how the story goes when she's telling me. She says, I'm getting ready to come to your office. Then I see in the same eye that I have like a curtain in front of me. So I rub my eye, it doesn't go away. So then I got really scared. I said, okay, let me get in the car how I am and just drive over there. She drove to the office and she said, I'm here to see the doctor. I don't have an appointment, but this is an emergency. I need to see him ASAP. So the concierge front desk person didn't know what to do with the case. He came in and said, she said it's an emergency. I said, well, she never come like that. So let's get her right in, put her in the room. She told me the story. I said, okay, say no more, because I said, this is a retinal detachment or it's a retinal tear. Before I even examined, I didn't do a full examination of her eyes. And she goes, are you going to take my blood pressure? I say, no, forget about your blood pressure. We're gonna try to salvage your eyes. I think you have a retinal detachment. So I move her to the ophthalmologist. Ophthalmologist then dilated her. We examined the eye. And lo and behold, the lady's on a retinal tear. Now, a retinal tear is often the first stage that will lead to retinal detachment. So retinal detachment is more severe than a tear. Tear is when the retina behind your eye layers start moving away. So it's like when you develop a blister in your skin. So when you develop that detachment, that little blister behind the eye, that's what we call a tear. If it's a big blister, then we call it a detachment. It's more severe and it can lead to blindness. So immediately we got the eye doctor to take a peek at her. We were able to send her to get the laser treatment. We arranged everything. And 2 days later, she came back and said, my vision is back, everything is normal. And I felt so good. I say, wow, I felt like I'm a doctor. Yay!
And you actually
I can take care of people.
Yes, and you
It's one
actually
of those,
kept somebody from becoming blind.
Becoming blind, especially knowing that I didn't know that her mother, became blind. And then when she came back, she said, she lost one eye. And a few years later, she lost the second eye. And they didn't know what it was. So I said, most likely she had, because it can run in family.
And so it just happened just like that, from
It's
nowhere.
very spontaneous out of nowhere. You can see in patients that are diabetic, diabetic patient can run in family, but it's very, very spontaneous. And basically, what the person will see is the flashes and the flutters. And if you see it on both eyes, like if you stare at high beams in a car and then you look the other way and you see those flutters going by in both eyes, usually those are benign. But when you see it on one eye, especially if you see not the full eye, but one quadrant. So one quadrant is if you're looking at my face and your flutter is coming from your right upper corner of the eye, and they're moving only in that side, or toward my nose in your left lower of your right eye. So usually that's to be of more concern that when you get those flutter on both eyes.
But I was just thinking about what you just said, because I can picture a woman like that thinking what she's going to call an ophthalmologist. And maybe in a week, they might have an appointment, right?
Which is what my ophthalmologist say. She have already seen my ophthalmologist. And she said, thank God you didn't call my office. Because most likely they would have sent you to an urgent care center. Urgent care center, they usually don't have eye doctor like we do. They don't know you like we do. So they probably from there will ship you to an emergency room. The emergency room is no a eye institute, just an emergency room. They're going to say, okay, you are having this, make an appointment. These are some of the doctors that can see you. And good luck trying to get one of those persons to see you.
Well, that's why you have Saturday hours, I think, too. You now, it's only Sunday that you're not there, and you are there in a different way.
I'm there.
You're there working in a different way.
Right.
But
right.
it's amazing that you're able to now keep your office open. And then how are the home visits going?
It's going well. It's going well. We are not pushing. We are not a company that is devoted just to home visit. We see home visit as an integral part of healthcare. There are people that do need home visit should take this into consideration. There are people that all they do is home visit. So you are at home because you are homebound, and then you get this provider that is isolated from the rest of healthcare that come in and they can write your prescription, and they can, a nurse can take care of that. A telephone call can take care of that. Nowadays, we can write prescription on the internet and send it to the pharmacy. So, I felt that doing a home visiting company by itself it's a disservice to the patient. I want to bring my center to the home. So my podiatry will go to the home, my dermatologist will go to the home, dental department will go to the home. It's a true service when the person is homebound.
It's like a clinic on wheels.
Exactly.
Thinking about
So the different components of that clinic will come to the home and provide the best service possible. Even though you are homebound, I think we all deserve that. All Americans deserve to be taken care of. You imagine some of the veterans that came in and they are homebound. To get one of this company that they are isolated from the rest of healthcare to come to the home. And, sometimes I get some of my patients that I need to do an x-ray And if I think a portable X-ray that will go to the home and take an X-ray won't be sufficient to give me the information, the data that I need to make a good medical decision, I'm going to say, no, I'm going to ship you into a hospital, get the X-ray, and bring you back because I'm going to make better medical decision.
Okay, and I'm very determined now to do better about giving your phone numbers out. You know, everyone loves the show, and I tend not to do it. But the way that you're going to get to see Dr. Mencia is by calling for an appointment, if possible. Sure, emergencies do exist, and I'm sure that they would take you. But let's just say that today, open on Saturday, is their center down in Fort Lauderdale, which is 1608 East Commercial Boulevard. And their phone number is 954-489-1345. I'll repeat that, 954-489-1345. This is Pencil Talk Radio. It means that you got to get a pen and a pencil, a paper and a pencil, and write these numbers down. Now, if you live up in the Palm Beach County area, they have an office. It's not open on Saturday, but it is open by Monday through Friday, right? And you call them and make an appointment. It's 561-270-6494. 561-270-6494.
And this the Boynton office on Saturday will work on emergency, if you call the operator and say it's an emergency, I need to see the dentist or the doctor, they will try to accommodate for you. Today we have dental department. Dr. Nina Cunningham will be
the periodontist.
And
we're talking now about Fort Lauderdale.
Right.
Okay.
So Dr. Nina will be working. Dr. Rosemary is working. The full dental department is open on Saturday today. The dermatologist is there. The podiatrist there. The dietitian is there. It's a full, it's a full clinic. It's fully open, fully functional on a Saturday.
Right.
Just before Mother's Day.
Oh, so if you go to the dermatologist, you could even get some Botox.
Yeah, exactly. And fillers and all that good stuff.
Right. So, but does your dermatologist deal with a lot of older adults that have, it's benign cancer, spots?
That's his. That's his love. And he's one of the few dermatologists that do go to nursing home and retirement community. So he's very mobile. He's a perfect match. We've been together for probably 8-9 years now, working together.
People laugh about that because years ago, 30 or 40 years ago, no one went to a dermatologist to get these spots taken off.
Right.
But now that's where the melanomas and the cancers come, isn't it?
Exactly. And we have one of my dear friend, physician that passed away about 11 years ago, had a little spot on the bottom of on the sole of his foot, and he neglected it. And as he penetrated, he started developing some lymph node on the inguinal area of that leg. So when they look at that and they examine him, he has a full-blown melanoma. He died, a young doctor. So you need to get yourself checked. And the other day, I have a doctor that came from South Carolina. She's doing her residency there, and she has a little spot on the sole of her foot. Reminded me of my colleague. So
when you say a little spot, you mean like a sore?
A dark
what
spot,
is it?
no, a little dark,
spot.
A little dark spot, no bleeding, nothing like that. So I make an incision, and one of my assistants, Oscar, was like,
I love Oscar.
6 p.m.
I love Oscar.
The office was already closed, and she came in. I need to get this taken care. Take a look. I want you to take a look at this. I said, well, I'm not going to wait for the dermatologist. I'm going to take it out and send it to the lab. It was a melanoma. But we were lucky enough to get the whole thing out. So we ship her back to the Carolinas. So when you get there, get this suture taken off.
So I'm going to ask you a question that I don't know if you can answer. Maybe it's an unfair question, but how does something like that happen?
The melanoma?
Just like that on the bottom of your foot?
Oh, well, where you get sun exposure. So
the bottom of your foot?
Of course, you lay down in the beach with your leg up, and you roll over. Now the sole of your feet are facing the sun, and doesn't take much. And a lot of people don't examine themselves. If you if you are at risk of skin cancer, you have to examine your body. Take a mirror. If you cannot bend your leg, take a mirror and take a look in there. And when in doubt, when you go to the doctor, yesterday I had a patient say, "Please, doctor, I know I can see the podiatrist here, but just take off my shoes. I want you to look at my left toes." She was in the verge of developing gout. She had all the symptoms, and it was red and it was warm. So we put her on treatment. And when something like that happens and you have that relationship with the practice, we prevent things from getting worse. I had a patient with gout that thought that he stepped on something, and you see the patient hopping around, the family seeing him hopping around. Let's go and get checked. Let's see what's going on. I said, I think I stepped on something. I think I twisted my big toe. It was beefy red, and it was, very advanced. So it took a lot of medication to cool down a gout attack in that individual. And the problem is with, when you let something like that go, something simple like, a gout attack, you let it go, they can deform your joint permanently. That only surgery can then try to bring that toes back into position.
I don't know much about gout.
Yeah. Well, gout is called the rich man disease because in the 1800s, when a rich person will, of course, you have your feast, so you eat a lot of red meat and red wine, and then they develop this pain on the big toes. Usually the big toes of one of your feet, although it can attack other joints like the wrist or the base of the thumb. The crystal, when the crystal precipitate, it's called the uric acid. Because of all the red meat and the wine, you develop uric acid overload, and the crystal then will precipitate and give you like an arthritic type of pain. It's a joint pain, but it's get very red, very inflamed. It's very aggressive, and it can eat up your bones and your joint.
We don't hear much about this anymore, do we?
Well, no, we have treatment. We use allopurinol that you probably hear a lot of people saying, "Oh, I take my allopurinol every night." You hear of colchicine. So we have indomethacin. Now we have medication that are excellent in treating and then in preventing a recurrence of attack. The only advice I have to give on gout is, because you had an attack and usually they put you on very high dose of allopurinol to prevent the uric acid from rising in your bloodstream, in your system and your joints. You do not have to maintain high dose. You have to keep coming down to see what is the lowest dose that your body needs. And it's not because allopurinol is a bad drug. It's okay, but it's a drug. It's a chemical. So what I do with my patient, I guess some of my patients, they come with 300 milligrams, just to give you an example, 300 milligrams twice a day. And they've been taking it, say, "Oh, since I have a gout attack, the doctor told me never come off the drug." And I would say, yeah, they're right. But why don't we try taking only 300 milligrams at night, and I want to see how you do. So they go and they take 300 milligrams. Then I say, okay, let's go down to 200 at night. And usually I stop around 100. If the patient cannot tolerate 100, they feel they're getting a little bit of symptom, then I pump them back up to 300 and then drop it down to 200 because that's their dose. So I try to individualize the treatment as much as possible, but I bring it to the lowest dose possible to use it as a preventive treatment. Because right now, if you're not having a gout attack, there's no need to be so aggressive with the treatment. So with the thing like a urinary cystitis, you get a urinary tract infection, you get a little cystitis, You come to the center, you get treated with a little cystitis. It will never become a full-blown urinary tract infection, a UTI. It will stay as a cystitis. Why is that important? In young person that are up and about, most likely a cystitis might become a UTI. But in an elderly person, and we're talking about people in the early 80s and early 90s, it's so easy for a urinary tract infection to spill into the blood and become what we call now urosepsis. So once the urinary tract infection now jump into the blood and become urosepsis, the person feel weak, they get sort of confused, and people will go, oh, mommy, just getting more confused. It must be Alzheimer's, sneaking into her. Usually no, it's usually some organic condition going on. So it's important that before we blame aging, especially when something acute, something sudden happened to our loved one, think of an infection first, think of an infection second, and think of an infection third before we blame aging. And it's like the joke of the lady that goes to the doctor and say, doctor, my right knee is killing me. Can you do something about it? And say, yeah, just take some Tylenol and you'll be okay. She take Tylenol, call the doctor, step into the office. This is not helping me. Okay, add some aspirin to the Tylenol, see if it get better. She goes, the next day she's back. She says, this is not getting any better. This is getting worse. Okay, take ibuprofen 800 milligrams. He's trying to shut her up, like, please, lady, leave me alone. Lady come back and say, that is not working. What's going on? You have to do something about my knee. It's killing me. He's not even examining the leg. He go, Mrs. Smith, can you see? You are 89 years old. It's just your age. You're getting old. So she goes, but doctor, pardon my stupidity. How come my left knee that is also 89 years old is not killing me?
That's very good. No, that is really good. I haven't heard that. But and see, that's why you are so different than any other doctors that I've ever heard of, Dr. Mencia. First of all, you try to regulate their medication. You never allow to be an older person can be confused with what's really wrong with you. I just don't know. I'm so glad when you do your teaching. I know you go to a lot of places and give talks to a lot of other doctors. I don't know why you're like this and so many aren't, because how many people are over-medicated and die earlier because they're not being watched?
I tell you,
It's
when
amazing.
I go and lecture to other physicians and hospital, medical groups, I feel so blessed to be able to do that, because it's like, I see us, the doctor and the nurse practitioner and the PA, we are the source of the problem. Because, even, one of my patients, he's a retired physician, and he came to see me Thursday this week, and he is 98 years old now. He just lost his wife a few months ago. And it's interesting trying to work with him, a 98-year-old patient that is coming to me, a retired doctor, and we're talking about his blood pressure. And I say, well, you're taking lisinopril. He say, yeah, well, that's an ACE inhibitor. And I say, well, you take also atenolol. Well, that's my beta blocker to slow down my heart. I say, yeah, but your blood pressure is not well controlled. So we are going back and forth, trying to come up with a regimen that he's agreeable to, because he's the patient, it's still his life, right? That he's agreeable, that he will be happy with. But he's very respectful to my knowledge, and he knows I'm very cutting edge. He knows that I'm going to look for what's best for him. So I finally convinced him. I said, listen, we have very advanced kidney disease. And at 98, we have already spoken about dialysis. You say no dialysis, which I promise you will never be dialyzed. We're going to try to treat everything conservatively, just like you requested. So why don't we increase lisinopril, that is an ACE inhibitor that will protect your kidney even more? He said, that's why I like you. So we came to an agreement.
Yeah.
Well, most patients say, okay, my blood pressure is high. And they say, okay, doctor, what are we going to do? So they trust us. We are, so most of the time we become the source of the problem. Because we have to sit down with the patient, and even if the patient is a physician or not, or a nurse, we have to do the thinking. We have to do the analysis. We have to be the detective.
But first you have to ask the questions, which you do.
Exactly.
You take the time to ask the questions, and you have so much experience. I think that plays a very important part. You've seen so many patients. I hate even to ask you, how many patients have you seen throughout your medical career?
Oh, my God.
I know. You have to think about that. I don't even know how you'd ever know.
But it's a blessing. It's something that I love doing. I love it so much. When I was growing up, my father used to say I was going to be a lawyer because I used to argue with him in a nice way, respectful way.
Yes.
They say, you like to argue so much. I know you're going to be a lawyer. So, but once going through my training as a psychologist, all of my science professor would say, become a doctor. So
that was the best thing that could have happened. And we want to thank you very much. I know we've run out of time. Let me give all the phone numbers. The phone number in Fort Lauderdale is 954-489-1345. The phone number in Boynton is 561-270-6494. This is a perfect time if you want to come in for a Saturday appointment. If you're having any dental problems at all, if you haven't had a good teeth cleaning, please
get
go
your nail
and see
clips.
them. What?
Get your nail clips. See the dietitian to lose weight.
Oh, right. It's a one-stop shop, isn't it?
It is.
Well, thank you,
It is.
Dr. Mencia.
Anita, it's a pleasure, and happy Mother's Day to all of those wonderful mothers out there.
Yeah, you take care of all of us mothers.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.